Hi, my name is Meet and I work as a registered physiotherapist at Resilient Physiotherapy in Guelph, Ontario. In today's video, we will go over what is trigger point and how trigger point dry needling can help relieve the myofascial pain syndrome and helps you to improve the mobility as well. So starting with what trigger point is, many people would call trigger point as a muscle knot as well, which is typically the adhesions in the muscles that affects the mobility, that makes the movement painful, that makes the activities like getting up from the chair. Many people might complain if they have trigger point in their hip, they might complain about the sciatica pain. If they have pain in their neck, they might also have some tingling or numbness going into your arm. So the trigger point can definitely cause that. But that's not the only reason for that pain though. So that's why assessment is very important. But in today's video, we will talk about how trigger point can cause that pain and how dry needling can help with that pain too. So when trigger point is developed, which is most commonly because of overuse of the muscle or sometimes even underuse from compression of the muscle. So let's say if someone has a desk job and they are sitting on their hip muscles all day long. So because of compressing all those muscles, they might have some trigger point in the hip area and in the neck too. Depending on the location of the trigger point and the muscle in which the trigger point exists, you might have the pain traveling up or down the trigger point or the leg as well. So in trigger point dry needling, the technique involves using the acupuncture needles. I can show you the needles here. So using the needles to poke into the trigger point itself, and once the needle goes in the trigger point, it unlocks the muscle, it breaks that knot, and then the functionality improves. Now when we do dry needling, because we are trying to go into that trigger point, so imagine this being the trigger point or the part where the muscle is locked. So first we will be able to identify where exactly the trigger point is, and then once the needle is poked into the trigger point, it causes muscle to twitch. The twitching is involuntary, and when twitching happens, the muscle twitches like this and then it unlocks and then it releases the trigger point. As soon as it unlocks, the pain-free mobility improves. And eventually, once the pain-free mobility has achieved, we will do strengthening to make sure the trigger point doesn't get developed in the same muscle. So few conditions where we cannot use the dry needling technique is if someone has bleeding disorders, or if someone has blood infectious disorders, if someone has active cancer in the body that they are aware of, if someone is immunocompromised, or if someone is pregnant, we cannot use dry needling on them. So talk to your physiotherapist just to make sure it is safe for you. And then they will also go over some of the risk factors depending on which muscle they are doing dry needling on. But it's always better to consult your physiotherapist or any other healthcare professional to make sure it is safe for you. Thank you so much.